Joining us. We're going to do a webinar today talking about some services available. We have a special presenter today. So before I get into that, I would like to welcome everyone. So thank you for taking time. I know you guys are really busy. Thank you. We will be recording the session and the slides will be made available on the CPC Plus portal. Everyone is muted. All the participations are on mute, but if you have any questions or comments, you can use the chat. I'll be monitoring the chat. And then the program, we will have a survey at the end. If you can kind of just complete the survey and let us know a little more information, that always helps us tailor future education events. So again, thank you for coming, really appreciate it. And now it's my pleasure to introduce Jessie Fernandez. She's a section supervisor for the Health Improvement section of the Chronic Disease Prevention and Health Promotion Bureau at the Montana Department of Public Health and Human Services. Imagine how big her business card is with that title. So Jessie is going to share with us the resources that are available through the Department of Health, some of the resources available through the Chronic Disease section of the Department of Health. So I am going to just turn it over to Jessie, and Jessie, you can take it away. Thank you so much.
Thank you, Patty. Thanks for the nice introduction. I appreciate you guys inviting me to speak today. I'm excited to share with all of you on the call about all of the resources that, well, maybe not all, but many of the resources that the Chronic Disease Prevention and Health Promotion Bureau offers to patients and healthcare providers around the state. So I do have quite a few topics I'm going to cover. I'll probably just go through them. They're organized by disease topic or behavior topic, but you'll see that many of them are related in terms of what the project is or what the resource is. So the first thing I was going to call your attention to is the Asthma Home Visiting Program. This program has been around for a number of years and is a 12-month program, 6 visits for someone with uncontrolled asthma by a nurse or respiratory therapist in their home or and a few over the phone. It used to be targeted for only children, and I just want to let everybody know that now we're enrolling adults into this program. It's available in about 22 different counties around the state, and patients can get some really great resources from the program. There's free mattress and pillow covers. Depending on the household, they could get an air purifier. There's educational materials, support coordinating with their other healthcare team, and then through a partnership with the American Lung Association, they might be able to get some other home environment materials as well. The program has demonstrated some really great improvements for patients with uncontrolled asthma. You can see many of them on the screen there. One that I really want to point out is that at the beginning of the program, only a quarter of the participants have well-controlled asthma, and by the end, nearly everybody has their asthma well-controlled, which is a great benefit to our patients and quality of life. Some other resources that the Montana Asthma Control Program provides is some printed materials. There are materials specific for children as well as some for adults. You can find an order form on our website that's on the slide there and order many of these products that I have on the screen here as well as some others, and we'll ship them to you at no cost. The other thing that we offer on the left-hand side, there's a picture of our asthma demo kit, and with it comes some demonstration inhalers and some other educational materials that you could use in your clinic when you're working with patients with asthma on asthma education. Moving on to then some educational opportunities for healthcare providers. The asthma program hosts the Big Sky Pulmonary Conference each year. It'll be coming up at the beginning of March at Fairmont Hot Springs. For about $200 registration fee, you get most of your meals provided and 12 continuing education credits. We'll be getting registration open pretty soon, probably in the next few weeks, and the agenda will be posted, so you can watch our website for that. We also offer several webinars throughout the year. They're an hour over the lunch hour. They come with free CE as well. Another educational opportunity, if you have anyone in your office who'd like to become a certified asthma educator, we offer a couple different courses depending on the year for helping people sit for the exam, as well as some training materials. We could link you up with a mentor for somebody who's taken the exam and passed it if you're looking to study and take that exam. The next course will be the beginning of May in Helena. And then the asthma program offers a couple of different projects for working on quality improvement in your office related to asthma care, guidelines-based care. We can provide some continuing education for staff related to the Expert Panel Report 3 guidelines for asthma management. Those come with free CE. And then if you're willing to participate in a quality improvement project related to asthma, there's a small stipend and a year-long support that could go with that project. So the two opportunities, one is for clinics that would work, see people more regularly for managing their asthma. That's the Diagnosing and Managing Asthma project. And then the other is targeted more to emergency departments, and that would be providing asthma education upon discharge. So we'll move on next to the diabetes program. The Montana Diabetes Program coordinates the diabetes prevention program. You may have heard it. It's been a big national push to expand the National Diabetes Prevention Program. It's a 12-month lifestyle change program you see the goals listed there on the screen. There's a lot of different ways that someone could be eligible for this program, including taking the prediabetes risk test or some of their lab values. The program in Montana is one of the longest running in the country. It has been going for these data are a little bit old now. It's in its 11th year. We've had almost 10,000 participants with some really great results. On average, a participant loses 12 pounds and really improves a lot of their lab values. We do have some funding opportunities right now for sites if they would like to become a national DPP provider, or if you would like to partner with an existing DPP site to offer telehealth, or potentially if you yourself already are a national DPP provider, there's some funding opportunities to offer that program via telehealth. For people with living with diabetes, the program supports the Quality Diabetes Education Initiative, working with clinics and other healthcare facilities and pharmacies that are providing diabetes self-management education and support, or you might hear it called DSMES. We have some opportunities for helping people working on becoming a recognized or accredited DSMES program. That's either through the American Diabetes Association or the American Association of Diabetes Educators. And then similar to the asthma program, support for becoming a certified diabetes educator, linking you with a mentor, helping you study for the exam, and then incorporate a CDE into your workflow. Diabetes educators can be a really powerful resource for people living with diabetes. So this is just a summary of some of those resources that I was mentioning. We have some funding opportunities to help your facility become accredited or recognized, as well as then an expert who can help you with the process. And then if you currently are a diabetes self-management education support provider, working on making your services available via telehealth. The diabetes program also offers some small funding for clinics that are interested in working on a workflow related to diabetes quality improvement. There's some support for using your EHR to collect data and measure any of your progress. And then we have some registries that could be available for you. The Diabetes Quality Care Monitoring System, DQCMS, recently went to a web-based version and would be available for people wanting to track outcomes specifically for their diabetes patients. There is some funding available as well for doing a quality improvement project related to diabetes, specifically making referrals to those programs that I was mentioning, the National Diabetes Program, Prevention Program, or DSMES services. The other is related to a project around chronic kidney disease. And then I just wanted to highlight the diabetes program also offers an annual continuing education credit conference. They just had it in October, and the next one won't be until the third week of October in 2020. The Montana Cardiovascular Health Program has recently started implementing the Health Coaches for Hypertension Control class. It's an 8-week class that's offered only in a few places around the state right now, twice a year. Montana right now is only the second state in the country that's offering this program, so we're slowly rolling it out to different places. South Carolina right now is the only other place. But you could be referring any patients with hypertension to the classes in those 4 counties that I have listed there. And the next round of classes will be starting in January. The Cardiovascular Health Program as well offers some funding for working on quality improvement projects in your facility, in your clinic. There's technical assistance available, support for reporting quality metrics, working on a PDSA cycle, and then funding available. And right now, the funding for the Cardiovascular Health Program is mostly allocated for this year. There are still some opportunities for clinics to work jointly with a pharmacist on medication therapy management, but the others won't come available again for more funding until summertime. But there's 3 different projects there working on either specifically hypertension and cholesterol quality improvement, as I mentioned, medication therapy management, and then another project for identifying people with undiagnosed hypertension. The professional conference for the Cardiovascular Health Program pertains to stroke education. The Rocky Mountain Stroke Conference will be May 8th in Missoula. Many of you are, I would imagine, are familiar with the Montana Tobacco Quit Line. I wanted to just throw in the information here of their general quit line for the public. There's a lot of free resources with the quit line for quitting tobacco. But they also have some new programs that I wanted to let everybody know about. One is specific for youth, called the My Life, My Quit quit line. Free coaching for anyone under the age of 18, 5 sessions, and coaches that are specifically trained to work with teens and youth. They also are still promoting the American Indian specific tobacco quit line with American Indian coaches and extra counseling support with that quit line, as well as the pregnancy related quit line that comes with some extra incentives for women looking to quit smoking during pregnancy. We know that providing extra support for those looking to quit leads to a better outcome for their quit attempt than just counseling alone. So being able to go through the quit line and have access to some of those other resources like nicotine replacement therapy can really up somebody's chances of being able to quit tobacco. Our Montana Cancer Control Program offers a screening program for breast and cervical cancer. So they have free mammograms and Pap tests for uninsured or underinsured women. Should a cancer be detected, then that woman would be eligible to enroll in the Medicaid's cancer treatment program. They also coordinate some free patient navigation services. So I listed here the eligibility for women for this program, and then a real benefit for this is they reimburse at Medicaid's rate and reimburse pretty quickly once the bill has been received from our office here. I'm sure everybody is familiar with the opioid epidemic going on around the country and in Montana. Some information here. I reached out to our opioid partners in the Bureau, and there are a lot of partners working on this in different organizations, and asked them for some of the resources that are available, and I got this list of all of these trainings that are available. I don't have all of the details on what each one is specifically about. They do have these next couple of trainings coming up in December on engaging the recovering brain. And like Patty said, these slides will be available at the end, and anybody's welcome to reach out to me, and I'll get you in touch with the coordinators of all of these trainings for behavioral health and medication-assisted treatment. They also are promoting the naloxone Master Trainer course for people who'd like to be trained to be able to train others on how to administer naloxone. So there's two steps. One is the online learning module, and then there's another skills session, and you can see that's run through Best Practice Medicine. They have a specific website if anybody's looking to become trained on being a master trainer. Another resource for clinics would be having a staff person become a certified behavioral health peer support specialist, and having them on your team for delivering medication for addiction treatment. There are free trainings for people offered through the Montana Peer Network, and now Medicaid is now covering those services, so they're reimbursable now. The opioid program also offers a lot of different resources. There's this guide that you can get copies of for patients and caregivers on how to recognize overdose. And then we have an online web map on where there are locations to drop off prescription drugs. So there's, you click on one of the stars, and then the pop-up box will tell you all the locations where someone could take unwanted prescription drugs. I'll just spend a couple minutes on a couple other programs that are available likely in your community that could be a resource for referring some of your patients to. The Walk with Ease program is a 6-week walking program, really open to anyone at any level who would like to start walking and maintain a physical activity program. It has been shown to decrease pain and fatigue and depression, as well as improve confidence for exercise. Another community-based program that's out there that could be a potential referral source for your patients would be the Stepping On program. That's for older adults who have either recently fallen or have a fear of falling. It's a 7-week course with a 1-hour follow-up a few months later, and addresses a lot of different topics about vision, medication management, the home environment, and slipping and tripping hazards, as well as then teaching participants some low-impact exercises that they do it during each class, and then they can be doing it at home. Our Bureau also coordinates a worksite wellness support for those looking to incorporate any policies or programs into your employer's wellness program. I put a slide in here in case any of you work with your site's wellness program or looking to be able to offer some sort of service for your employees. Any of these programs that I've just, any of the community programs that I've just been talking about could likely be incorporated into a wellness program or some sort of incentive program that your employer might offer. We also can offer some support with model policies for breastfeeding or tobacco use or having healthy meeting foods, ideas like that. Then we also work with some contractors at the county level who work with different employers in your area that might be of interest to you. So that was a lot of the programs that our Bureau offers or funding opportunities that might be relevant for your clinic. I just wanted to highlight some of the different ways that you can find out more about resources in your area. One is our community programs web map. I have the website listed here, and when we send the slides out, I'll make sure that's an active link. This map encompasses a lot of the different things, as well as a few more of the things that I already talked about in my slides. The Asthma Home Visiting Program, Diabetes Education, Diabetes Prevention, Fall Prevention, all of those. The counties that are highlighted in blue indicate that the program is available in that county. And if you were to click on that county, the information would pop up on how to get in touch with someone related to that resource. So within the map, we have all of our education programs, exercise, tobacco, cancer screening contacts, and then some resources that we have for people living with a disability. Many of you are probably familiar with the Montana 211. It's also an online directory of other resources available in the state. I know they're building their database, so it might not have everything that you're looking for, but it is a resource, and we're looking to do a better job of getting all of our resources listed there. I recently was made aware of this resource as well from the Montana Judicial branch. I wanted to throw it out there. I thought this was a great resource. They update it every year, and it's just a PDF for each county of different resources. Looks like my table of contents there got cut off, but it has all of the services related to transportation, utilities, financial, social services. So it could be, if you just want to print something off, that could be a good resource. And then the last thing that I wanted to highlight is our effort to bring the Connect referral system to be statewide in Montana. Connect is a bidirectional referral system. It had been used in several different communities in Montana over the last 10 years. You might be familiar with it depending on your location. But now the system has been made statewide, so you could have connectivity or referral capability basically across the state. And right now we're looking at onboarding different organizations to start using it to do bidirectional referrals. It's a great way to send a referral for your client and then be able to know what the outcome was, if they attended or if they declined services, and then be able to potentially receive referrals from other organizations in your area or outside your town or county. So I can also connect anyone who is interested in this if you want to reach out to me after the webinar later this week. So I went through and just summarized most of our program's websites on this slide, as well as some of the other things that I talked about. We have our general email address there. If you sent something there or to that 800 number, it would get routed to the correct person. I also put my contact information at the bottom. Feel free to reach out and ask me any questions, and I will refer you on. We have a lot of different people that work on all of these different projects. I just was the one that was talking about them today, so there's a lot more information or details that go with each one if you're interested. So we'd be happy to work with you in your facility at any time, or just be a resource if you are looking for something specific or be able to help you out. So at that time, I'd be happy to take any questions or any comments.
Jesse, thank you so much. That was a lot of really good information. If you do have questions, you can go ahead and put them in the chat right now. Or if you want to get additional information or contact information from Jesse, go ahead and note that in the chat as well. As she went through here, I mean, I think it was obvious to everybody on the phone, the alignment with the CPC Plus program, even just the community resources, that ability to identify the resources in your community. That's an ongoing challenge that I hear from a lot of the CPC Plus practices. So if there's a database doing that for you, that's great information. And if any of you want to work on, as you know, the diabetes, A1C, and then hypertension, blood pressure control are the main measures in CPC Plus. There is some funding and some support available if you want to do quality improvement around there. But a lot of you already are doing good on those measures. There's other measures and support available like asthma, et cetera. So anything that you're interested, please let us know. And I'm not really finding anything in the chat, Jesse. So I think we can let you all go back and get a half hour back in your day. But I want to thank Jesse so much for presenting this information for us and pulling it together. We really appreciate it. And everyone, yep, go ahead, Jesse.
Oh, just thank you. Thanks, everybody, for being on the call today.
Yeah, thank you, everyone. And then have a good rest of your day. Thank you, Maynette, for your support as well. Take care.
Hi, thank you.
Bye.